Hello team, this is Ayman Said. I'm a clinical fellow working for the NHS. In the first place, I want to thank the team for giving me this chance to present my interesting case because I believe it is worthy to be shared with the medical field and such a conference would be a good chance to do this purpose by like spreading knowledge and as well to let others be aware of such rare complications that might be happening after a pleural procedure. I want to tell you a brief intro about myself. My name is Ayman Said. I used to work as internal medicine trainee back in Egypt, and now I'm working as a clinical fellow in medicine for the NHS. So today we are talking about re-expansion pulmonary edema, and this is a really rare complication that might be happening after the pleural procedure, specifically the chest drain, what is called the chest drain. All right, so let's start. All right, so first of all, re-expansion pulmonary edema is a rare and potentially fatal complication that can occur after the rapid re-expansion of a previously collapsed lung, such as from a pneumothorax or pleural effusion. Of course, we all aware of pneumothorax and pleural effusion, and because sometimes they might be causing a total collapse of a lung, or even though a collapse of a lobe of the lung. So usually for this we are doing a procedure that's just a drain to get rid of the pneumothorax or the effusion. So this rare complication, it represents nearly 1% or less from the total number of the pleural procedures that have been done till now or being reported. Usually it should happen in 1 to 2 hours after procedure, and let me tell you more in the upcoming slides because this is why I think our case is a little bit interesting. So we are reporting a case of a male patient in his 80s who developed bilateral re-expansion pulmonary edema, and this happened after 12 hours after the pleural fluid being started to be drained. And it is recommended to do the drainage in like a controlled amounts and according to the guidance. And we have done this actually. We have been draining this not that quick, but was monitored under control. But despite this, he had a typical presentation that happened after 12 hours, and as well it was involved in both lungs. So this is why we think this is a rare type of rare already complication. So this patient had multiple comorbidities included being elderly, he had heart failure, AF, and as well severe frailty and type 2 diabetes mellitus. We think and we believe that this all have contributed to such a typical course of the complication. So what happened that the patient after the procedure, despite he was stable, but he was anyway on oxygen. But afterwards, like by 12 hours, he started to be in shortness of breath. He started to need more and more oxygen. So we have done a chest X-ray beside, and which showed signs of bilateral lungs congestion that given us the impression of the pulmonary edema that was after the re-expansion of the lung, the left one. And this followed the procedure by 12 hours, as I told, and it was bilateral as well. So we have started immediately the protocol as IV diuretics to get rid of the congestion and as well oxygen support. The patient kept deteriorating anyways. So in usually a fit person that he can tolerate this, we might be thinking of higher ventilation modalities like an IV. But given that he had such comorbidities, he was in a delirious state actually, he was doing very poorly. So as a team, the consultant as a team deemed that would be inappropriate in his case, will not give him any more improvement, but would just causing him more and more discomfort. So we've kept an eye and everything, but the patient, despite that, like continuing to deteriorate. So the team and the family had a discussion, and we all as a team, the consultant, and as well the family, all concluded the palliative care should be prioritized to prioritize his comfort, because we thought he's dying, but would be dying in agony than dying in comfort. So we have prioritized the palliative care then, and this was unfortunate. He died afterwards, but was in comfort. So this case actually is highlighting an unusual presentation of re-expansion pulmonary edema that underscores the need for close post-procedural monitoring, and this should be beyond the immediate period, because usually people would be keeping an eye and be vigilant for the upcoming 2 to 4 hours, but this one has developed this after 12 hours. So as well, the team should be aware of such rare complications, because most of us, all of us, would be aware of the common ones and would be mentioning them to the patients when they're consenting them for the procedure. But this one actually, not from the usual one that we are consenting the patients for, and we should be informing the patients before a complication, even if it is rare, but it has some possibility to happen as well. So we have to conclude that bilateral and delayed onset of re-expansion pulmonary edema, this could happen despite the typical one should be unilateral, or not should be, usually would be unilateral and would be in 1 or 2 hours, but despite this is rare, it should be put in the differential diagnosis and to be put in brain about what complications that might be happening to come earlier to our brains and our thinking when our patients are having difficulties in breathing after the procedure. This report actually reinforces the importance of clinical vigilance and adherence to updated guidelines to improve patient safety and outcomes. So I hope that my brief presentation about such an interesting case and such an interesting topic was very informative to you and has given to you some new thing to think about or learn about. So I want again to thank the team about giving me the chance to present this interesting case to the conference. Thank you everyone, and bye bye.